This film is intended for eye surgeons for training and education purposes. Viewer discretion is strongly recommended. Let me share a few tips and tricks while dealing with dense cataract, especially when you have planned a classical 4-quadrant technique, that's the divide and conquer. What should be the length of the exposed tip? These are some of the points which I am going to discuss, and they would be helpful to most of the beginner surgeons. The machine which I am using here would be the Alcon Legion machine, and I'm using a balanced tip. The first thing is the incision. The main incision should not be too long. This is a 2.8mm width incision. I don't want it to be beyond 2mm. So this is anywhere between 1.5 to 2mm what I have created. If you have a very large intracorneal tunnel, there is a higher risk of the wound hydration happening. There's more amount of dimpling of the cornea, corneal folds, visualization is hampered. So we want the best of the visualization to be there. So there's a reason I would prefer to have an intracorneal tunnel of about say 2mm, not beyond that. The first tip. The second tip would be to have a rhexis which is bigger than my usual rhexis. So my usual rhexis would be around 4.5 to 5mm, but in this case I'll be aiming at 5.5 or 6mm rhexis. Thankfully, this case the pupil is very well dilated, so visualization is not going to be an issue. The cornea in general is a little bit hazy, it's not very clear, it's an elderly man and it's to be expected. So we have a rhexis which is of adequate size. So I'm going to do hydrodissection using very little fluid. That's the key here. We don't want excess amount of fluid to go inside, and there's always a risk of the capsule blowing up open. So using very small amount of fluid just to ensure that the corticocapsular adhesions are all broken. If required, we can repeat this in different quadrants, but the key is to inject a very small amount of fluid. The reason is simple. These long-standing cataracts, the capsule will be very thin and there's a higher risk of the posterior capsule blowing out if there is an inadvertent buildup of pressure within the bag. So once the decompression is done, time to rotate the nucleus. Before I start emulsifying the nucleus, let me pause here and reiterate two principles to follow. There are two risk factors when managing these complex cases. Number one, there is an increased risk of endothelial damage. And number two, there is also an increased risk of capsulozonular complications that would happen when you're trying to divide the nucleus forcefully. So to counteract the first problem, it's mandatory that we use copious amount of viscoelastic, preferably the dispersive one which has the chondroitin sulfate, which sticks to the cornea well. This ensures that the endothelial trauma is minimized, and mind you, it needs to be replenished as and when required. Now coming back to the division of the nucleus, one can choose the technique of their choice, either a direct chop, which could be a vertical chop, or a horizontal chop. My go-to technique in such cases is the classical 4-quadrant technique, especially after the availability of the torsional energy in our phaco machines. It would be very difficult to perform this long trenches with using a longitudinal phaco machine simply because the amount of heat generation is enormous there, and there's a higher risk of wound burn when you're using longitudinal form of phaco. And thankfully, because torsional is relatively less heat generating and has got better cutting ability, so I have reverted back to the classical 4-quadrant technique only after the availability of the torsional energy in our phaco machines. The next tip which I'd like to share here is I would want to expose the tip very long. Now, contrary to the regular exposure which we use for our usual cases, the exposure would be just about 1 to 1.5 millimeter in length, but in this case the exposure is about 2 millimeter. It's pretty long. The advantage which I get by exposing this tip long is that I can have a better reach, I can go to the posterior plate much more easily, and I don't have to make a very wide trench to accommodate the sleeve, simply because by the tip itself I can reach to the more posterior parts of the nucleus. The reason I prefer the 4-quadrant technique also is that Because we have cored out the most densest part of the nucleus, the amount of stress which we put on the bag and the zonules during lateral separation maneuver is significantly lesser than when compared to the direct chop technique. So that is one of the reasons why I prefer the classical 4-quadrant technique in these ultra hard cataracts. And if you follow the right principles, it's actually very stress-free to manage these dense cataracts. The next tip would be, while I'm trying to sculpt, I always stabilize the nucleus with my second instrument. This is a chopper. This helps me to prevent the nucleus from jumping around, get a good grip, and then the trenching would be very seamless and efficient. I begin with the power which I'm going to use is 90% power in this case, and in the situation where it is not cutting or good enough, I would not hesitate to move on to 100% as well. But usually 90% suffices, and even with this amount of energy setting which we have used, there is barely any heat generated in the wound, and hence lesser the risk of the wound burn happening. So let's begin the trenching now. When you're doing trenching, the most common mistake by the beginner surgeon would be they would tend to push the nucleus, which happens more often than not in these ultra dense cataracts. The trick here is to use the highest amount of energy which we can afford, and I'm using 90%. You can see the tip has to just go through it effortlessly without pushing or tugging at the nucleus. A common misconception is that sculpting itself is going to induce a lot of stress on the zonules. Well, it does if you're using the physical force to trench the nucleus rather than the ultrasound energy to do the job for us. If you're using just the ultrasound energy and it cuts very efficiently, we can see that there's hardly any stress being imparted to the posterior capsule. And this is possible nowadays because of the availability of the torsional energy, which is extremely efficient in cutting across the density of the nucleus and without generating much of a heat. The nucleus is rotated 90 degrees after a couple of strokes, and then the next groove is created. As the grooves are being created and the nucleus rotated, every subsequent groove will appear to be superficial than the previously sculpted ones. So again we go back and deepen this groove, and this grooving is continued until we reach the 90% depth. The classical way I teach is to assess the depth, look at these horizontal striations, they have to disappear, and there is a color shift. This area becomes extremely dark. That is suggestive that maybe we are in the right plane for us to attempt the nucleus separation. So the only disadvantage with this 4-quadrant technique is it takes a long time, but nevertheless it's predictable, safe and reproducible by most surgeons. So now I'm convinced that the depth is adequate, so I'm going to start dividing the nucleus. The next tip here, when you're doing lateral separation, the only secret to achieve this effortlessly is to keep both the instruments at the bottom of the pit. That is, I usually tell my trainees, your instrument should be scraping the posterior plate. So once you ascertain that your instruments are scraping the posterior plate, then only you're going to move the lateral separation maneuver. It has to be very gentle. The lateral separation maneuver has to be just laterally. The common mistake many beginners make is they would be pushing the nucleus down as well when you're trying to separate them. So remember, that is not to be done. The separation has to be very gentle and both the instruments are moving away from each other laterally. Now, because the adequate sculpting was done, the separation of these fragments was relatively effortless, and now is the time to perform the quadrant removal. Now, this is the step where maximum amount of endothelial damage can happen. The most common reason would be the lens chatter and turbulence itself can rub against the endothelium and cause the endothelial damage. And of course, the second reason would be the allergy delivery is much more nearer to the endothelium. So if possible, it's always preferable and advisable to use a posterior plane of emulsification. That is, one should aim at keeping the probe at the level of the rhexis margin or slightly below it. We don't want it to be near the endothelium. The next step would be, when you're using the phaco power to emulsify it, ensure that you're using the right amount of energy. Start with a lower amount of energy, gradually increase. If you use excessive energy, there is going to be lens chatter. Our goal is to ensure that the lens just dances around the tip so that it doesn't run away from the tip and go and hit the endothelium. That is what we mean by turbulence and lens chatter. The next tip, our second instrument acts like a shield. It is placed on top of the fragment which is being emulsified. This ensures that very less amount of fragments are going to fly up and hit the endothelium. The chopper is placed up. The only job is it's protecting the endothelium and prevent the fragments from flying around and hitting them. Of course, next golden tip here would be very patient. Come out of the eye after each fragment is put. Push in OVD. I prefer to push in first the dispersive OVD, that is the one with the chondroitin sulfate, against the endothelium, and HPMC is placed under it in the antechamber. The reason for doing so is that HPMC is less thermogenic, that is less ability to generate heat compared to the one which has the chondroitin sulfate. So again, this ensures that there is a lesser chance of heat generation happening at the wound. Next tip, obviously the most important, would be patience. So I'm taking a lot of time to emulsify each fragment very slowly. Now if I use higher power, I can eat up these fragments in a jiffy because the torsional energy is so efficient. But that would be deleterious to the endothelium. Going very slow, using less amount of energy, ensures that we have got better control on the emulsifying fragment, and hence we can decrease the lens turbulence. So corneal endothelium is priceless. It's worthwhile to spend this extra couple of minutes to put in OVD and to go in slow with our emulsification. This ensures lesser turbulence, lesser lens chatter, and clearer corneas in the first post-op day. This is the last piece to be emulsified. Again, you can see that the fragment is just dancing around the tip. My second instrument is being held on top of it, acting like a shield. Slowly but surely, the fragment is emulsified. The rest of the steps are routine. You remove the cortex, place in the lens, remove the OVD again, hydrate the wounds, and that's it, the case is done. So to summarize, few take-home points. And with the availability of torsional energy, the classical sculpting and four-quadrant technique has come back in vogue. Simple because the machine can give a good cutting ability. By following this classical four-quadrant technique, the surgery becomes very less stressful because the lateral division maneuver is much more easier and quicker because we have cored out almost 90% of the densest part of the nucleus. So it's easy to laterally separate, and lateral separation is a step where most mishaps regarding the posterior capsule or the zonules happen. So that part is taken care by this efficient sculpting which we can have. And to achieve efficient sculpting, I prefer to expose my tip slightly longer in these denser cataracts. Again, while quadrant removal, you can again reduce the exposure and make it to 1 to 1.5 millimeter. That's all right. So that was it. Thank you for watching and hope you found this helpful.